points are really as it relates to TPN, which I've looked through. I actually, oh man, this is no good. I think somebody used a non-dry erase over here. God. Man, they really want to try to keep this on here, so they messing with my crew.
Well, you said another boy, maybe in the 301.
There you go, backside. Thank you for that. Whoever grew up. Dang. Not as much, but this looks worse. This definitely. Ah, man. Who did this? Y'all know? What's up with me? Yeah, I'm gonna try that.
You can hear, right here.
Oh, real.
I'll pick one over there. I'm gonna try this one. Huh? Let's see it. I'm gonna try that one next. Huh? No, it's not. I got one in my office, so there we go. I got one in my office, so if I have to go down there and get it, it's not doing much. But you see it's taking off a little bit. I might need to use one of those antibacterial wipes.
No, that's not.
This ain't doing much out. I don't know.
You got your number?
Try one more. This is it right here. Ah. It's just saving the day for everybody. Look at this. It's not coming off. But it's more powerful than whatever we had. Let's see. I don't know. I'm still elbow grease in this bad boy. Man. God. It's not. I know that's what you're hoping for.
Yeah, you probably supposed to get your boy.
This ain't gonna work. I'm gonna have to make it put this all over my hands now. It's just a shirt. It's just a shirt. Dang, man. So they messing me up. But it's okay. Everybody take out some paper. Got some paper. We're gonna go old school. Take out some paper. We're doing 15 problems, so you know, you're gonna you need a couple sheets because I want you to show your work. It's okay to write on the back. Huh?
You should have came at 9. Class started at 9.
They told me 9:30.
They told you
Everybody's always doing it at 9:30. This class is 9 o'clock.
They told me 9:30. Oh, well, I wish I was.
Okay, 9:30 to what? What did they tell you?
9:30 to 11.
Because everybody always comes at 9:30.
Well, hell, they should have told me. We done had a head start. It's okay, we got some time to make up. Cool. Everybody have their paper out with your name on it? Okay. Now, it was best at this moment. The little messed up board. All right. So what we'll do is everything that we're gonna go through today meets two criteria, at least for me. The first criteria is that this is all real. The patient's names have been changed, right? But I've taken actual scenarios that's actually done in pharmacies. Every last one of these scenarios is something that you'll actually do. Well, actually do for this particular patient in this scenario. This scenario, the patients that we'll go through are hospitalized patients at various stages, right? So if you never, all of you will be in a hospital to do your rotations at minimum. So this scenario is what's commonly done in one setting or another in a hospital, all right? The other thing that scenario that it means is everything that we're also gonna talk about is gonna be on your board exam, okay? So since it's something that you'll need to know for practice, certainly, but even before you get to practice for your board exam, it meets those two criteria, so you have to be able to know how to do this. I mean, like, this is supposed to be easy, so okay? So this is walk around knowledge. Anytime you're unstuck for this, so this is stuff that you should already know. So hopefully, we'll knock the cobwebs off a little bit today, then after the day, you're walking around with it. All right, so with this particular patient, who wants to read the case for me? Anybody?
Edwin Johnson.
Appreciate First one.
Ethel Johnson is a 55-year-old woman who presents to the ED with complaint of vomiting blood and bright red blood in her rectum. She was in her usual state of health until shortly after taking a dose of lactulose, when she began to feel sick and subsequently vomited a large amount of blood into the bathroom sink. She also reports a 2-day history of BI.
You don't know what that is? You just said it.
Oh, right. The physician orders a stat CBC, CMP, UGI, EGD, and RCPI.
All right, so, based on, I know that you've had a lecture already, upper, lower GI, does this make sense? It's common, we're missing anything? 50-50, yes, no?
Yes.
I like it. Yes, did I hear yes?
Yeah.
Okay, all right. So, very common, especially patient presents to the emergency room. We don't know what type of GI bleed they may be having, but we'll still commonly to start a PPI of some sort. We're gonna start IV PPI. And here are the two that are available, IV, and these are the indications that we'll use these IV proton pump inhibitors. All right, so here's where the magic happens. You'll have this order for esomeprazole, 80 milligrams IV infused over 30 minutes. It'll be followed by 8 milligrams per hour as a continuous infusion for 72 hours. So this is common. Here's your protocol. Your hospital protocol mixes 2 vials, 40 milligrams each, with 5 mLs each, then dilutes it with 100 mLs of normal saline. So calculate the flow rate in milliliters per hour for the loading dose. And I'll give you 2 minutes.
Okay.
Yo.
Why was she blowing the blood?
Huh?
Why was she blowing the blood?
I didn't tell you yet.
Okay.
Everybody done? Got 1 minute left. If you need that extra minute. All right, 10 seconds. All right, just write something down. Write something down. All right, what brave souls gonna tell me what they came up with? Okay, I have to call names. Simi, what did you come up with? Still working on it. 2 minutes over. Oh, this is warm up. All right, John, let me know. No? That's it. That's it. I can't hear you. You gotta pump up the volume.
I believe it's slow volume fluid being infused over time related.
Okay? Give me a number.
105 divided by 72.5 hours gives me a rate of 1.44 millimeters per hour.
All right, tell me that one more time. You did what now?
So I added the total volume of fluid being infused.
Okay. Which was what again?
But I only used 5 mLs of the normal saline injection, and then what's being diluted for 100 mLs.
All right.
Total of 105.
Okay.
And I did that over 72.5 hours. That 0.5 is coming from the 30 minutes.
Okay.
I don't know if that's.
All right. So, I hear 2 errors. The way that you set it up is right, but your numbers are wrong. Okay, the first error, what's the total volume? Is it 105?
110.
110. Okay, so that's the first thing. 110 should be, we're using 80 milligrams total. Each 40 milligrams is 5 mL. So for 80 milligrams, that'll be 40 times 2, so it'll be 5 times 2. So your volume of drug will be 10 mLs. You added it to 100 mLs. All right, so the total volume is 110. And then we're looking for the rate per hour, and I told you that the 80 milligrams, the loading dose, is infused over 30 minutes.
Was it 220?
Right?
220.
So that would be 220 mils per hour.
Per hour.
Right? So how the math works, it's like this. Conceptually, you should be able to see it, but again, if I wanted to do the math, 30 minutes is a half an hour, meals per hour. So that'll now be 220.
Yeah, I got 220.
Oh, okay.
Okay. Any questions about that? So where did be brave go out there first? A little bit.
Where's the 72? I don't
72 hasn't come up, right? Because you have 2 different things that are going on. You first have an 80 milligram loading dose, and then you have an 8 milligram per hour infusion, right? So all I asked you about was the loading dose. If I asked you about the maintenance dose, which I could do, you still, the way that you set up this problem will still work the same way. Unless I asked you the total amount of drug that they received, you would never use 72 as a denominator, right? Because, I mean, you could, but you're doing the math wrong in my opinion, to do it this way. you'll have 8 milligrams per hour. If I asked you to convert that to mils per hour, because, you know, most of the time I ask you for a flow rate, it'll either be a volume per time or an amount per time. I gave you the amount per time, so we can easily ask you for a volume per time. You still would use 72 in order to come up with those mils per hour, right? So this is telling you how long it'll be, you know, for 72 hours, but there shouldn't, unless someone's asking you the total amount that they're receiving over that period of time, you wouldn't use that 72 as your number, okay? So a question can commonly be set up this way. Obviously, this is what, if you looked it up in Lexicon for Micromedics, this is what it'll tell you. But for purposes of calculating flow rates, or really most things that you'll do, you wouldn't use the total amount. It's just kind of like if I told you someone was gonna receive a dose of antibiotic, 1 gram every 8 hours for 10 days, you wouldn't use that 10 days in any calculation to tell them what they're gonna be using today. So it's just really more of a duration. All right. So, since Leslie was asking me about the maintenance dose, this is asking you for the flow rate, and I gave you a little hint, in mils per hour for your continuous infusion. So you should need 2 minutes for this one. So I give you a minute and a half. Have this one. That's it.
64 milliliters.
Huh?
64 milliliters.
How did you do it? I don't really remember the answer just yet. Just tell me how you did it.
There's 40 milligrams in 5 mLs, and you're doing 8 milligrams per hour.
Okay.
So you just set it up 5 mLs over 40 milligrams times.
Well, remember, you still diluting.
Still over 110.
This is still your standard protocol.
So 8 milligrams over 110.
Hold on. So what? So do you still have 80 milligrams
No, you have 80.
in 110? You don't?
Still got 80. 2 vials, 40 milligrams each.
No, because you already used your 80 milligrams.
So what about
You have to set it up with the 1 bottle.
You still have that, right? Still using the same bag. We're just not giving it over 30 minutes. We're not giving all 80 over 30 minutes. So, when you still have 80 and 110, 8 per hour, right? Oh, that's at the bottom, sorry. the first scenario, we just took it all and gave it over 30 minutes. In the second scenario, we want to just give 8 milligrams per hour. Right? Instead of 80 milligrams per 30 minutes. So the infusion rate would change. Now, one of the things that, does anyone have experience in the hospital already? One of the things that sometimes, well, 2 things I mentioned. The first thing is I'm gonna tell you what the hospital protocol is, okay? Don't tell me what your hospital protocol is. I don't care. All right? I'll tell you what it is. If you go to one hospital protocol may be one way, and go to another one, it may be a different way, and they're not gonna care what your old hospital did, okay? So you just need to follow the rules of what this hospital is, okay? So this will be the protocol. The second thing, and that's the more important thing, because I don't want you to get confused, like, oh, how do we do it at my place? That doesn't matter. Read the question. The second thing is the more important thing. There are 2 strategies that are used when making IVs. This is one of them. One strategy is taking the medication and putting it all in the diluent. The other strategy is what we call volume correction, where whatever you put in, you'll take out. So your final volume will be 100 ml instead of 110. Does that make sense what I'm saying? Here, the volume of drug is 10 mils. I just showed you. We added that 10 mils to the 100 to make 110. Happens all the time. Sometimes we don't add it. It's 10 mils, so I take 10 mils out of the 100, and then I add the 10 mils, so the total volume is still 100. Okay? Both of those strategies are used. But the question will tell you what that protocol is, all right? Whether or not you're gonna just add it to the total volume, or it'll be the standard concentration, all right? Either way, both of those things are done, all right? So, same thing, your questions that you'll be given, they'll either make it clear that you're adding it to it, or this is the final concentration. Does that make sense? Right. Okay. So again, this one should have been straightforward. You already have what the recipe is, that you're taking 2 40s or 10 ml, adding it to this, so then now it's 80 and 110. If I'm going 8 milligrams per hour, I already have the milligrams, now I just need to have the hours. All right. Question number 3. All right, so you finished the workup. Here are the lab results that you received. So based on this, what we're gonna do is start a new therapy and discontinue the esomeprazole and start octreotide. Now, just like we saw with esomeprazole, octreotide has a loading dose as well as a continuous infusion. So this again is showing us what our standard concentration is. For that, same question as the first question. Calculate the flow rate in mils per hour.
Excuse me, Dr. Cooper.
Yes.
I'm still not clear with the first one.
Okay, what's the question?
I'm still not clear with the cancer.
So what's the question? What are you not clear with? We've done 2 problems. The very first one. Okay, so what did you do?
I did the 2 vials, that was the 5 ml for each vial. That was 10. And then added it to the normal,
Uh-huh.
that was 110.
Correct.
So yeah, I didn't know what else to get.
You use it over 30 minutes. So I asked you to give me the flow rate in mils per hour.
Okay, so doing the 110 over 30 minutes.
No, because that would give you mils per minute, wouldn't it?
Okay, 1 hours, so 0.5 hour for the time.
Right. They gave you what? For your thing? All right. That sounds right. Okay. All right. So take that and do it with this one. Meals per hour. You done? You pushing away? Okay. All right. You done? You think so? All right. You think so, or you know so? Think you did? All right. Tell me what you did.
I put 1250 microgram over 250 microgram per milliliter.
All right.
Multiply by 50 microgram.
Oh, what's up with this? Why are we hanging out on the moment? Ah, man. Who did this? Just my luck.
Your free trial over.
I don't think I had a free trial. Maybe that's why, huh? Like I was supposed to pay something. Free trial is done. 14 days. Oh, pay 14. All right, sorry about that. Okay, this is where we were. All right. So you said you put
So,
1250 over 250.
1250 microgram over 250 milliliter.
Uh-huh.
Multiply by 1 hour per 50 microgram is equal to 10 milliliter over
No, wait.
hour.
10 milliliters per hour.
Yes.
Let me see it again.
Oh, no. Yeah, man. Don't.
This one.
Those cross out. So now I have
It's 40.
hours per milliliter.
Switch this one to this one. It's 250 milliliter over 1250 microgram multiply 50 microgram over 1 hour.
Okay.
Okay.
All right. And you came up with 10 milliliters per hour.
10 is not right.
10 is not right.
10 is right.
It's 48. It's 48.
All right. I'm hearing 10 is right. 10 is right. Yeah. You came up with the right number, but because your
I set up reverse.
yes, your ratios were set up properly, it's just your units were not.
Yeah,
Yeah. So you came up with 10 hours per milliliter instead of 10 milliliters per hour.
yeah. Yes.
But the 10, if your ratio is set up properly, would. So this should have been real easy. It shouldn't have even taken you longer than a minute. We gave you the standard concentration. We also gave you the infusion time. All you need to do is just change it to mils per hour. So there's really ratio. You could do it by ratio, proportion, or dimensional analysis. Oh. And dimensional analysis is what I showed. Now, let me just give my disclaimer. Use whatever you're getting correct, okay? So if you grew up using ratio and proportion and you got the right answer, continue to do that. Now's not the time to learn something new, okay? If you grew up doing dimensional analysis and you're getting the right answer, do dimensional analysis. They're gonna come up, no method is more preferred than the other. Whichever one that you are comfortable in doing and getting the correct answer, that's the one I want you to do. That's true criteria. The one that you're comfortable and getting the correct answer. Don't tell me, oh, I'm comfortable in doing it this way, and you keep getting the wrong answer. Now it's time, let's get comfortable with something else, okay? But if you getting the right answer, let's not do something else, all right? But no matter if you set a ratio of proportion or dimensional analysis, you should have come up with 10 meals per hour. All right, here's the next one. All right, so I'll give you 2 minutes on it. 2 minutes starts now. All right. 1 more minute, if you need. All right, we good to go? Still have 20 seconds. All right, who has it and wants to share?
They get 4.8 bags of the 250 ml.
They get 4.8 bags
Yeah.
of 250.
1 bag.
I said, who wanna go? These 1 baggers didn't say anything. Tell me, how'd you come up with 4.8?
Is that right or wrong?
According to your classmates, it's wrong, but I don't know yet. Tell me how you did it.
Oh,
Huh?
I see my mistake there.
You changed your mind.
Yeah.
What mistake did you make?
I think I did a calculation, 50 micrograms to 10 milliliters, because with the 10 milliliters times 24, and that will give you 240 milliliters.
Okay. All right. I'm still confused though. What you're saying is in 24 hours, you need 240 milliliters?
No, it's for 2 days, it's 204.
No,
2,400. In 2 days.
In 2 days is how much?
In 1 day is 1,200 milliliters. In 2 days, I multiplied by 2 and I came with 9.6.
9.6 bags? Okay. All right. So let's look at this. Let's look at this for a second. Let's look at this. It's 50 mics per hour, right? And you have 1250 per 250, right? Which is how many mics per meal? 5, you said?
Yeah.
5, right? So a total bag has 5 mics per meal. We already said it's running at 10, giving 10 per hour. Forget all this math. It's going at 10 meals per hour. How long will that 250 meals last at 10 meals per hour? 25 hours, won't it? So, in one day, I'm only gonna use one bag. Right?
I don't know how big you can.
Okay?
So
Let's
that's
go again. You've already converted in the problem before.
We already had 10
Granted,
minutes.
but even if, so that's what I'm saying. That's why I go through this. I want you to do it. I can go up there, write it down, yeah, oh yeah, but that doesn't mean that you understand what's going on. That's why I want you to do it. We said it's running at 50 mics per hour. You've already converted 50 mics per hour to mils per hour. Okay? You can do this same problem either way. All I'm telling you is that if I took 50 and I divided 1250 by 50, what would you get? Because I gave 1250, that's the total amount of drug. And I'm giving it 50 per hour. If I took 1250 and divided it by 50, what would you get?
25.
Should get 25. If I took this conversion, 10 meals per hour, divided that, the meal part, should give you 25 hours. Doesn't matter how you do it. This is telling you the amount per time. This is telling you the volume per time. But my bag is giving either the amount of 1250 micrograms or the volume of 250 milliliters. Either one of those will tell you the total amount of time this bag will last, which is 25 hours, right? You get that part, right? I asked you, we're just dispensing, how many should we dispense in a 24-hour time period? Still only one, because one bag should last for 24 hours. Right? In this case, more than 24 hours.
So if
Right.
you want to go to the actual math,
If I want to go to what?
through the actual math, you use, for 2 days, you calculate for 2 days or 1 day.
One day. A 24-hour supply.
So you don't multiply by 2.
No. What I need to multiply by 2 for? Even if you multiply
Because it says she.
by 2, that's still for 2 days or for 48 hours. The math is still gonna be the same. It's still gonna be 10 meals per hour or 50 mics per hour. Regardless if it's for 24 hours or for 48. It's still per 24 hours or 48 hours. And what I asked was 24. If you multiply it by 2 and we're asking for 1 day, you still have to divide by 2. So it's gonna still give you
So
more.
does that mean the 250 mil is the amount in one bag?
Yeah. The 250 meals is amount of 1 bag.
Okay.
Absolutely.
Oh yeah, we did something.
All right. Said do what?
41.9.
So I just showed you one way, and I talked you through another way. But if you took the total volume with the problem that we did before, 10 meals per hour, then you should have come up with 25 hours. But you can do it this way too. The total amount is 1250. You can divide that by 50. It's still gonna come up with 25.
With the calculation, if you get 240 mil,
Yeah,
you still dispense one bag.
correct. Correct. Uh-huh. What that 240 meals told you is that's how much you need in 1 hour, in 1 day, and you have more than that. So I still only need 1 bag per day.
If we use 10 milliliter per hour, and we don't need to multiply by 24 hours.
No, why?
Because
Why? If you did, even if you did, you wouldn't, even if you could do 10 meals per hour times 24. That's telling you I need 240 meals in 24 hours, right?
yes,
And you have 250. That's still 1. No matter, that's what I'm saying. You could have done, you just have to know what math you just did. What math did I do? If I multiply 10 meals times an hour, what do I not? Now, one of the things, we're not on the board, so I always tell you, put your units on there so you know exactly what you have. If you multiply 10 meals per hour times 24 hours, what's your final unit that you have? Meals. So I have 240 meals in one day. How many do I'm comparing 240 to 250? I still only need one. One bag will still provide 240 meals. So that's all I need in one day. Yes?
Yeah, I'm thinking, how did you come up with about 10?
How did I come up with the 10? Okay. All right, so we've already talked about rental function and creating clearance before. So for this particular patient, their creatinine clearance, their serum creatinine changed from 1.9 to 2.6. What's their creatinine clearance? Somebody trying to go somewhere. I hear the navigation. 2 minutes. Well, I better give a minute and a half because we're starting to run out of time.
Which is ideopathy. 2.2.
That's it, 2.4.
75.
I'm going.
Mm-hmm.
All right, 20 more seconds. All right, who has it? Who has it?
42.45?
42.45? I don't know. How'd you come up with that?
That's what I got.
That's what you got? Tell me how you did it. Well, what information on here do you need?
What did you
We
use?
need the weight. So we're gonna convert the pounds to
42.45.
You need the
And then
gender,
you need the age of the female.
and you need the age, right? All right. So 140 minus, what's that age?
55.
55, we said it was 55 earlier. So 140 minus 55,
You get 85.
you got 85,
And then you said 72
divided
times.
by 72 times 2.6?
Correct.
All right. Multiply times what weight?
110 kg.
110?
Yeah, 10.
Because you have to convert the 242.
Okay. And then what?
And then you multiply times 0.85.
42.45.
That's your female? All right. Anybody got something different? You got 29.1?
Yeah.
Ooh, that's way different.
I use adjusted body weight.
You use adjusted by, why?
Because she's obese.
Oh. Because she's obese?
Yes.
Was that what you were gonna say?
It depends on what
That's what you, she beat you to it. I saw your hand up there, I did, I really saw it. All right. Okay, let's see.
Does it depend on the drug to determine if you're doing adjusted bodies?
It does depend on the drug, but we didn't talk about the drug here. You use adjusted because 110, what's the ideal by the way? 50, 52? Oh yeah, so that's definitely adjusted. That should be you. Yeah. That's definitely adjusted. So 29, yeah, this is wrong.
Okay, so is
So this is, it should be based on adjusted. So the first thing that you do is calculate the ideal body weight so that you can compare it to the actual body weight. Actual body weight was 110. Ideal, you said, was, which is this calculation, was what? 50 something?
52.4.
Right? And you divide 52.4 divided by 110. And if that number is greater than 1.2,
She was 5'3",
5 something, yeah. So you would have to be
so
7.
is it just 2.3 times 3, right?
Huh?
2.3 times 3?
Yeah.
I got 51.9.
Same thing though.
So I just rounded to 52.
Doesn't matter. If you took that number and divided it by 110, that's gonna be, what, 1.5 something? So that's definitely greater than 1.2. So that tells you to go to the adjusted body weight. Now I was asked this question, which I think I borrowed that particular question from another topic. It does matter what drug you're doing. So I think when I did that, I just copied that question from another question for medication where we would always use the total body weight. But I didn't give you a drug on this one, which means that you should go through this same type of chart, which is what I said before. So if the patient has a body weight that's less than the ideal body weight, we're gonna use their total body weight, right? Because it's less. If their total body weight is greater than 120% of the ideal body weight, then we will use the adjusted body weight. Otherwise, we would use the ideal body weight. So there are some exceptions. We talked about a couple of them before. We talked about, before I tell you, what medication do we always use the total body weight? Vancomycin, right? So I gave you an example of vancomycin. You don't have to go through all this, always use the total body weight. So there are some exceptions. With aminoglycosides, because of their profile, you want to use the ideal body weight unless they're obese, where you would use the adjusted body weight, otherwise you would use the ideal body weight. So there's some exceptions. You see a few exceptions here as well when you would always use the ideal body weight. So unless otherwise specified, this is what you should go through in determining. Anytime you see a weight that's used, this is what you would go through to say, which weight should I use? So it's not always the actual body weight. All right, so when we look here, if I told you for, what are we doing? Albumin. So for albumin, if I told you to use the actual body weight, how would you calculate the dose in grams for this albumin? So you should be able to do this in a minute or less. So I'm gonna give you 1 minute.
So use actual or this one?
Use actual.
Yeah.
come up with 100?
Because it's 1 gram.
Okay.
Over kilogram multiplied by 110 kilogram is 110 gram. And max is 100.
All right, sounds right. Did everyone hear that? So it should be easy. It's just one. It said 1 gram per kilo. The kilo is 210. I'm sorry, 110. Once you divide it 242 divided by 2.2, 110. So 110 times 1 is 110, but the max is 100. So the dough should be 100 grams. All right, so now, in this case, we gave 2 albumin. Now I'm asking about the norepinephrine. So what's the initial flow rate in mils per hour of the norepinephrine? All right, who has it? No one? No one? Ooh, y'all hurting my feelings now.
Let's give us another minute.
Huh?
One more minute, please.
One more minute? All right, 15 more seconds.
10.31. Yeah.
Tell me how you did it.
You see?
Yep.
So we had 0.05 microgram per kilogram,
Okay.
and that equals 5.5 microgram. And I put that over 1 minute,
Okay.
and then I did equals x over 60 minutes for 1 hour.
Okay.
Then I got 0.330 micrograms. I divide 8 milligrams.
Whoa.
I converted
Yeah,
that
what
to.
now?
I got 0.330 microgram. I convert that to grams.
Okay, so you got 0.33 grams, not
Mm.
micrograms.
No, I got a micrograms because I didn't convert it to grams yet because that's in micrograms, right?
right? So 5.5 times 60 is 0.33. Should be 330 micrograms.
Oh,
So I use the linear.
Okay.
oh, I did something wrong. 330. 330 micrograms.
Yeah, so the number that you were giving me was a
It was
converted
grams,
number.
yes, it was in grams.
Yeah. Okay, so there's a, I did this, again, I change up stuff just because I know people do things different ways. Since on the last problem I showed dimensional analysis, I didn't do that this time, I just showed this way of multiplying it out by ratio and proportion. You're gonna come up with the same answer regardless of what you've done. But the simple, this is the long way. Again, as I said, when you look at this, what am I trying to figure out? The simple way of doing this is to, number one, I asked you for the initial flow rate. So initial flow rate, none of this matters. You're not increasing or changing. What have we started at? We started at 0.05 micrograms per kilogram per minute, right? And we know that we're going per hour. So I need to know how many micrograms am I given in an hour? 0.05 micrograms times 110 kilograms times 60, which is this right here, should give me 330 micrograms per hour. So now how much do I have? Well, I know I have 8 milligrams in 250. So if I took 250, as I have here, over 8,000 micrograms, and multiplied that times 330 micrograms, I should come up with 10.31 milliliters per hour. Because I know how many meals I have. I have 250 meals. I know how many micrograms I have. I have 8,000. Now, how many do I give per hour? Because that's what it's asking me. And it's 330 per hour. So if I put 330 micrograms, it crosses out the micrograms there, and I have meals per hour, right? So we could have done it in 2 steps, but I just spelled it all out there. But this is the different drug, but it's the exact same problem. It's the third time.
So the 330 I gave you was in micrograms, and then I converted it to milligrams.
Yeah,
Yeah.
right. But you said, you told me it was 0.33 micrograms, and I said, no way.
I meant to say milligrams.
Yeah.
Yeah.
Yeah. Say that's your converted number.
Yeah.
330 was the microgram, right? Yeah, and the only reason why I stopped you there is because I've seen too many times. When you don't put the units, you're gonna take that number and convert it again or multiply it. They're like, yep, you were right on the right track, but you messed up with the units. The units confused everything. So that's why, again, especially when you're doing a problem that has multiple steps like this, micrograms per kilo per minute, that gives you milligrams and mils, and asking you to do it in mils per hour, there's gonna be multiple conversions that are done there. So I typically tell you not to either do it a very long way or just convert it where it makes sense. I can tell you personally, I don't like to do this way, because you plugging numbers into calculators, and it can get confusing. You shouldn't need to convert milligrams to micrograms. That should be easy. 8 milligrams should always be 8,000 micrograms. I don't need to convert that. I can just write this in 8,000 and 250. That way, I don't have to worry about multiplying 8 times 1,000. You shouldn't need to convert that. You should, I'm not saying you need to walk around saying what's 5.5 times 60. Make that the only conversion that you need to do. But you shouldn't need to convert 8 milligrams to 8,000 micrograms. You should be able to just write that down. That way you don't have to worry about that. So if you did that 250 over 8,000, and you multiply 60 times 3.5 to come over 330, then you would have had that the right answer. All right. All right, so sometimes I heard something, I didn't say anything earlier, because I put it here to make the point. When we're dosing, we look at ideal body weight as a comparison. Ideal body weight greater than 1.2 does not mean the patient is obese, okay? So let's not use those words. For dosing purposes, that's when we use adjusted body weight. Obesity is determined by body mass index, not by ideal body weight, okay? So we can use body mass index. This is the formula that you would use to do it. How do we interpret it? We know that based on diagnostic criteria greater than 30 is obese. You may see some guidelines that also define morbid obesity. Does anyone remember seeing anything like that? Okay, all right. So you may see some classification systems that also include morbid obesity as well. But for the most part, these are the standard numbers that you're going to see. I put a bullet point down here that especially when we're looking at risk of disease and things that we've learned within the last 10 years, not to only look at the body mass index, but also look at the waist circumference. It also gives us an indication as to whether or not this person is at risk for disease. Okay. All right, so calculate the body mass index for this patient and tell me if the patient is underweight, normal weight, or overweight, or obese.
42.9.
42.9, that's what you came up with? Plug it in. Anybody come up with something different? Like, I don't know yet, I'm still plugging. Okay. Plug it in the formula, it should be pretty straightforward. It can be kilograms per meter squared or pounds per inches. All right, so we gave you pounds already. We talked about that earlier. That should have been pretty straightforward. 42.9 kilograms per meter squared, which means that they're obese. All right, so let's go through these pretty quickly. Typically, when we're looking at parenteral nutrition, the reason why I like this from a calculations perspective is because pretty much you're having there's two ways that we'll calculate. Sometimes you'll calculate to determine calories. These will be the questions that you receive to determine the calories that are being provided or the volume that you'll need to meet those caloric demands. So I'm going to ask you about the volume, an amount on here, but I could ask you about calories as well. If I gave you calories, you can use that to determine volume. If I gave you volume for amount, you can use that to determine the calories. So there's two things that we'll highlight. One is the fluid, just told you volume, and then the other part will be the calories. These will be the two methods that you see most frequently. One thing that I tell you is that the first one is the one to use, okay? For NAPLEX purposes, for our exam, this will be the standard method to use. Once you get on rotations, sometimes they'll tell you to use this one. It is quicker. When we do the math, there's a lot of rounding when you're doing this anyway. So either of these methods will give you the same thing, okay? But this is basically telling you what your basic fluid need is for most patients, and then how to make adjustments based on this particular patient. And this is not giving a baseline amount that you're just making an adjustment on, and it's just taking the total weight. Again, you're gonna see either of these shoes for purposes of while you're in school. So for any exam or for the NAPLEX, this is the equation that you'll use. But I just wanted you to know that on rotations, you might see that as the second bullet point as something that they, oh, we use this here. You've already seen that. All right, so let's go ahead and do this for Ms. Johnson. What's the daily fluid need? And then I want you to tell me what infusion rate you would need to run your particular fluid if the max total volume is 2 liters.
So what is the normal range? So you count the over
Oh, how long? A day.
1 day?
Are you ready? You ready to give me this one?
Oh, no,
Not you?
Try that.
All right, who has the daily fluid requirement?
So I got 65.83.
65.83? Okay, what'd you get? Well, don't tell me. She gave her answer. I want yours. You were trying to give me an answer, so I gave it to you. What you going with?
So it's just that first time?
This is the first part. Daily fluid needs and meals per day. You got 3,300? What'd you get?
Multiply these two and then you add. Yeah, it's 110
1580?
minus 20
1580 is not
times
right.
20 plus 1,500.
So what you had was 1,500 plus 20 mils times 110 minus 20. So that should have come up with 330 meals per day. So that should have been the daily fluid need that you calculated. Now, it said though, now then I asked you, because that's meals per day, to give me the meals per hour for that day, but your maximum total volume is 2 liters. So you can't meet the daily fluid need just through the nutrition. That's what this is basically telling you. While this patient does need 3.3 liters per day, the only thing that you can meet with the nutrition is 2 liters. That's why I gave you that's not a rule. I'm telling you, that's what this is saying. I'm telling you how to interpret that. So your daily fluid need is just all volume, not just the volume that you're getting from TPN. Okay. So here at this institution, it's saying your maximum total volume is going to be 2 liters for this particular patient. So what that basically means is you're going to give 2 liters via TPN. You give the rest of it via outside fluids. Okay. All right. So how would you do that? 2,000 mLs divided by 24.
Mhm.
So it will give you 83.3. maximum total volume
Oh,
is
2 liters.
2 liters. This is 2,000 ml. 2,000 ml over 24 hours is meals per hour. Should be 83.3. Okay? So again, when you're looking at your daily fluid need, that's just your daily fluid need of all fluids, all sources. When we're looking at this is just one source. Okay? All right, we'll go through one more. Then I'll give you the rest as an assignment that I'll send to you through Blackboard, and then we'll pick up on Monday. I'll go through the rest of these after you've done the assignment, and then we'll finish strong with kinetics. All right. All right. So there's when we talk about calories, we're going to get our calories from 3 sources. So this is still review. Proteins, carbohydrates, and fats. These will be what we call macronutrients. This will be where you get most of your calories from. All right. When we go through the protein component, different institutions have brands that they like the best, but for the most part, I'm just going to use them interchangeably and just tell you amino acid. Right? These are all brand names that institutions have, and you're going to have varying percentages of those types. So in it, we'll give you that it's an amino acid, and I'll either give you the percentage as far as which one you're using, because that will determine what volume you would use, or we'll give you the amount. Well, no, I have to give you a percentage for you to tell me either the amount or the volume. So all of that will be included in any question. All right, so on the first question, gave you the volume. The percentage is 15%, and you need to achieve 1.2 grams per kilo of protein. How many meals would you need? We round that to the nearest whole number. How many meals of this amino acid would you need to add to the bag in order to achieve your goal of 1.2 grams per kilo per day? Anybody?
880 milliliters.
Whoa, how much? Why are you laughing, man? That might be right, I don't know. It just sounded, it didn't sound, I didn't get that warm and fuzzy feeling, you know what I'm saying? I just heard a number, I'm like, whoa. How did you do that?
I did.
Wait a minute, first of all, how confident are you with that answer?
After your feedback, I'm about to say.
My feedback. After my feedback, you're not that confident. All right, so, but prior to my feedback, you were very confident. So tell me how you did it.
Pretty much did 1.2 grams times 110 kilograms
Okay.
to get the amount.
All right, and what was that amount?
132.
Okay. All right, it sounded good so far.
All right, cool.
What did you do with that?
Okay, so then I kind of cross multiply with 15 over 100 mLs.
Wait a minute. 15 over 100 ml?
Yeah, for the
what?
Oh, 15 grand.
15 grams? 15 grams?
15 grand.
Okay, over 100 ml? Okay.
Oh, we using
And so I just multiply times 100 ml divided by
100 ml divided by,
50.
okay, tell me this one more time. 15 grams over 100 ml,
That's what
and you said cross multiply, so equals what over what?
So it's well, the total would be 880. I mean, I multiplied 132 times 100 ml.
132 times 100 divided by 15? All right, that's all right. That's all right. I just asked him one question. I just said, "You sure?" He's like, "What I say?" Whoa, whoa, whoa. Whoa, whoa, whoa. 880 is what he said. I said, "Whoa, whoa, whoa." Oh yeah. So this is what you said you did, right? And then you said you did that?
Yes, sir.
All right, let's do one more and then let's leave. I know I said that earlier. One more. I want to get y'all off on the right page.
So just out of curiosity,
Out of curiosity, yeah.
we're not using adjusted body weight because of the person's BMI being over 30?
No, I said just use the total.
Oh, you just said that?
I said just use the total. All right, let's do one more. I gotta leave here on a good note. That's a good note. Got 880, it's a good note. All right, let's leave on a good note. This side of the room. This side, right? Oh, you said you prefer the center? Is that what I heard? We prefer the center? Oh, okay. Kristen said, and it's gonna be me. Okay, all right, well, cool. That'll work for me. When we look at carbohydrates, it's the same. Primarily, we use dextrose, and you're gonna have a variety of percentages. What I can tell you is for TPN purposes, you're talking about the more concentrated amounts that you will be giving. The lower strengths are really just used for hydration, with the exception of, you may see sometimes if we can't start a TPN, we might start maybe a 10% solution of dextrose just to give them some baseline sugar. But the volume would have to be large. That's why we use much more concentrated solutions than that. Because we already have 880. What's the total volume we're gonna make? 2 liters. So 880 are already in amino acids. Okay. So we have to have a concentrated solution. So with this, we're gonna use dextrose 70%. How many mils will be required to provide 220 grams? You got me an answer? Don't forget an answer. Wait a minute. We're going with the center. That's what we do. You up on the left side here. We're going with the center. You ready? Okay, tell me.
315 ml.
315? That was less than a minute. How confident are you with that answer? 100%? Whoa! Not even 70%. 100%. That's the same answer you came up with? You rounded to the nearest whole number?
I got 342.
314.2?
That's what
Should be 314, yeah.
I got
What?
314.2.
I got 314.
314.2?
That's what I got, 314.2.
I got 314.3.
I mean, yeah, if you want to round.
All right, so tell me how you did it.
So I did 70 grams over 100 ml equals
so for purposes of the math, you know, we're gonna do like the standard rounding. You know, if it's 0.5 or greater, we'll go up, and if it's less than that, we'll go down. But in practice, if we needed 220, at least 220 grams of it, then of course your math tells you I need more than 314, so you could use 315. It's going to depend on the institution's rounding policy. So I'm not going to introduce any of that. But from a math perspective, it was 314.3 is what I came up with. So with that, we'll round to 314, right? And if it was 314.5 or higher, we'll go up to 315. All right? Okay.
So now you accept 310?
310?
No, you round it down. I missed this one.
314.
314, sorry.
Not the 310, no.
Okay, so you just round after this one, correct? Because it was 314.28,
Mm-hmm.
and we rounded to 314.3.
No, 314. Whole number.
Whole number.
Yeah, whole number. Yeah. Correct.
Did you adjusted body?
All right. Any questions about that? All right, y'all can do the rest, right?
By Monday, right?
By Monday, yeah. We're gonna pick up on Monday. 9 o'clock Monday? 9 o'clock, okay.
9 o'clock PM?
Not PM, AM. We don't want to sleep. All right, see y'all 9 a.m. on Monday, and we'll finish the rest of the problems. But you need to pre-finish. Huh?
You move to the next solution.
Oh, what is the solution that comes with that problem?
Yeah, 70 grams over 100 ml equals 220 grams over X. Cross multiply.